Okay, so this is the next part of the cardiovascular system. Just to recap, let's go over the anatomy of the heart quickly. I'm going to start with the right side, with the right side of the heart, which to us apparently in this picture is on our left, but either way, it's still the right. Okay, so we have the superior and the inferior vena cava. The right, right here, right atrium, the right ventricle, okay, of course, the right AV valve right here, and this is also called the tricuspid valve. Tri, means three, and because when we look at it, technically it has three parts to the valve. Okay, so that's that. Okay, now while we're still on this side, inside of the right ventricle, remember V for ventricle, we have the pulmonary semilunar valve right here. Okay, pulmonary semilunar valve. Check. All right, now let's go ahead and move to this side. Okay, the pulmonary semilunar valve opens up and leads to this large trunk called the pulmonary trunk. Okay, of course we know that the pulmonary trunk connects to the left pulmonary artery, which will lead to the lungs. Oxygenated blood comes back from the lungs and enters at the left and the right pulmonary veins. And then of course when blood moves through the pulmonary trunk, see how it splits this way to the left pulmonary artery and the right pulmonary artery, and then that obviously connects to the lungs. So both of these are going to lead to lungs. This is technically going to go to the right lung, and okay, and this one here, of course, is going to lead to the left lung. And it's important to understand that because now blood's going to come back from the lung and enter the heart at the left and right pulmonary veins. And of course they enter and they will fill into the left atrium. Okay, and then we have then blood will move to the left ventricle. Okay, but of course it has to cross the left AV valve, also called the mitral valve. Okay, and inside of the left ventricle, we have another valve. Okay, and this is one of the pulmonary valves, semilunar valves. This is the aortic semilunar valve. Okay, so let's go ahead and show that. The blood will push through the aortic semilunar valve and it will move into the aorta, and then of course from the aorta out to the body. Okay, now a couple of more things that we didn't actually cover. Now see these little stringy type cords, right, that are connected to they're connected to the valves and to the muscles of the heart, or well, the endocardium. Either way, these are called the chordae tendineae. You want to know what that is. Also, if you look inside, you see these kind of bumpy structures, right? Those are called the papillary muscles because technically they are muscle. This intersection, this intersection between the two ventricles is called the septum. Okay, and then of course we know the epicardium. The myocardium is this thick muscle wall, and then the endocardium. So you want to know the full anatomy of the heart. Now, the next thing we're going to talk about is the cardiac cycle. So as you very well know, the heart contracts and relaxes. That's just something that muscles do. Now, there's terminology that is important in the cardiac cycle and in the cardiovascular system. Okay, and I want to emphasize the significance of these terms. You're going to see them quite a bit. And the first one is systole. Systole means to contract. Okay, the other one is diastole. Diastole is relaxation, or when something relaxes one of the muscles. Now, the cardiac cycle is the cycle of the heart as it contracts and relaxes. And ultimately, we'll go ahead and start with atrial systole. Atrial systole is when both atria, the left and the right atria, contract. Okay, when they contract, they are going to pop open or push open both AV valves. Okay, the AV valves are the left and right atrioventricular valves. All right, and the blood will fill the ventricles. All right, at the same time, when these AV valves are open, remember that the semilunar valves are closed. Okay, so don't forget semilunar valves. There's two, the pulmonary and aortic semilunar valves. All right, so then there's ventricular systole. This is when both ventricles contract. So the right and left ventricle of the heart is going to contract. And when that happens, first of all, the AV valves have to be closed. And when the ventricles contract, they're going to pop open both semilunar valves. Both the pulmonary and aortic semilunar valves will pop open. Okay, then we have diastole. Diastole is both atrial and ventricular relaxation. So everything's relaxed at the time, and then the semilunar valves close. All right, now if you look closely at your book or your slides, this is the cardiac cycle. And ultimately, the best way to really learn the cardiac cycle is to watch a video. So I'm going to go ahead and play that for you guys.
The cardiac cycle explains the flow of blood through the heart. Recall that the heart is actually two pumps, each serving a different function. The pulmonary circuit delivers blood to and from the lungs, while the systemic circuit delivers blood to and from the tissues of the body. The average heart beats around 70 times per minute. Each heartbeat consists of a series of events, which are collectively called the cardiac cycle. We will start our tour of the cardiac cycle with blood returning to the heart and entering the atria. The right atrium receives blood from the systemic circuit. This blood is low in oxygen and high in carbon dioxide. The left atrium receives blood from the lungs via the pulmonary circuit. This blood has a high concentration of oxygen and a low concentration of carbon dioxide. When the atria contract, blood is forced into the ventricles of the heart through the atrioventricular valves. As is the case with all of the valves of the heart, these valves control the flow of blood and prevent the blood from flowing backward through the heart. Once the atria contract, they immediately begin to refill with blood for the next cycle. As the ventricles contract, the blood is directed through the semilunar valves into the arteries. The blood leaving the left ventricle enters a large artery called the aorta, which delivers blood to the organs in the systemic circuit. The blood leaving the right ventricle is delivered via the pulmonary artery to the lungs. The contraction of the atria and ventricles is coordinated so that the atria contract first, followed shortly thereafter by the ventricles. The cardiac cycle moves around 5.25 liters, almost 1 gallon, of blood per minute, or over 2,000 gallons per day.
Okay, so that's the cardiac cycle. The next thing we're going to talk about is the sounds of the heart and the valves. So if you were to listen to a heartbeat with the stethoscope, we hear this lub-dub, lub-dub, lub-dub sound, and those sounds are very specific. The lub sound, or the first initial beat, is what you're actually hearing is the closing of both AV valves during ventricular systole, and they make that first lub sound. And then the second sound or heartbeat sound is going to be when both of the semilunar valves close during diastole. And both of those are together going to make up the sounds that we hear when, if we were to take a stethoscope and listen to the heartbeat and its lub-dub sound. Okay, lub is both AV valves closing. The dub sound is both semilunar valves closing. Okay, the next thing is the cardiac conduction system. Now, I've told you in several times, maybe not. I'm not sure if you remember. Either way, the fact is that the nervous system is the boss. The brains and all of the nerves are in charge of everything. Every single thing that is occurring in your body is controlled by our nervous system, including the heartbeat. And in so many words, basically, the heart receives electrical signals from the brain. And the way that it works is like this. All right. So inside of the right atria, the heart has this little node. It's called the sinoatrial node, or the SA node. Okay, that's at the top. At the bottom of the right atrium is the AV node. All right, and now what's going on here is that the SA node acts as the pacemaker, the cardiac pacemaker, and it initiates every single heartbeat. And of course, the heart can be modified, the heartbeat can be modified by the nervous system. So sometimes your heart will beat faster, sometimes it'll slow down, depending on what is going on in the body, and what's in charge of that is the SA node. All right, now the AV node. The AV node is kind of like a relay of impulses. The way that you have to imagine we have electricity in our bodies, including the heart. That is why we can take a heart patient and give them a pacemaker that will basically mimic the effects of the SA or AV node, depending on what is exactly wrong with their heart, because the fact is, electricity pumps our heart. Okay, it's our nervous system electricity, but it's still an electrical stimulus. Okay, so the AV node relays the stimulus. Its job is to carry the electrical stimulus, and it's actually going to send it down into this area. Okay, these are specifically this is called the AV bundle right here, and down the septum and around. Okay, these are technically branches or bundle branches, and as they go around, these smaller branches here are called Purkinje fibers. Okay, so now the way the cardiac conduction cycle works is that, of course, the SA node is going to receive the signal to initiate the heartbeat. Okay, and see all of these green arrows? That is demonstrating the spread of this electrical signal. So the SA node is signaling both the left and the right atria to contract. Now, as the contraction signal moves from the SA node in the right atrium is going to stimulate the AV node. The AV node will relay the impulse down the AV bundle and around to the Purkinje fibers and carry this impulse to the ventricles and contract the muscles of the heart.
The heart's conduction system regulates the electrical impulses that make the heart beat. An impulse begins in a bundle of nerve tissue called the sinoatrial, or SA node. The impulse makes the atria contract, and blood empties into the ventricles. Next, the impulse travels to the atrioventricular, or AV node. It passes through the bundle of His, the bundle branches, and the Purkinje fibers. As the impulse reaches the ventricles, it triggers a contraction there, and the heart ejects blood.
Okay, next topic is the regulation of the heartbeat. So ultimately, I mentioned that the nervous system is the boss, and that is very true. However, the endocrine system plays a role in regulating the heartbeat. Okay, first of all, let's start with the nervous system. We have a segment of our brain called the medulla oblongata. Okay, this part of the brain has a huge role in several organ systems, but its role specifically in heartbeat is that it either increases the activity of the SA and AV nodes, or it will decrease the activity of SA and AV nodes depending on exactly what the body needs. So ultimately, we have different types of nerves. We have sympathetic nervous system and a parasympathetic nervous system. And don't worry so much about the actual nervous systems until we get to that chapter, but you do want to know this part, that of course the medulla oblongata regulates the SA and AV nodes through sympathetic nerves and parasympathetic nerves. Sympathetic nerves will always increase the activity. Parasympathetic will decrease the activity of the SA and AV nodes. Now, the endocrine system. Our endocrine system is involved in our hormones. There's different factors of the endocrine system, but the primary role is to regulate our hormones, and one hormone is directly responsible for heartbeat and increasing heartbeat, and that is the hormone epinephrine, which of course we know as adrenaline, and this is the one hormone that actually increases the heartbeat. All right, now we can track the electrical activity of the heart with an EKG and ECG, and a healthy heart makes this very specific characteristic pattern. It makes these three formations. Okay, so the first one, if you look down here at this this picture, what we're seeing is what an EKG should look like. Okay, this is one full cardiac cycle, and of course, you know, if we were to keep going, we would see this pattern over and over and over again. Now, a healthy heart makes a perfect pattern of what's called the P wave. So here we start with the P wave. A P wave is going to it represents on an EKG the impulse, the electrical impulse that we see that spreads across the atrium, the left and right atrium, which of course comes from the SA node. Okay, now if you look closely, you'll see this Q down here, RS, and it's called the QRS complex, and it makes this very specific dip, peak, dip, and it's referred to again as a QRS complex, and what it represents is electrical impulses spreading down the septum and around the ventricles and the Purkinje fibers that we saw in the previous video. And then finally, when the end of electrical activities in the ventricles, we'll see this last T wave. Okay, and then it'll repeat again. So a perfectly healthy heart should make this exact pattern over and over and over and over and over on the EKG. And if it doesn't, well, then that allows doctors and health professionals to be able to detect atrial fibrillation, ventricular fibrillation, issues with the heart, which are incredibly, incredibly dangerous. Okay, now let's talk about blood pressure, and I did teach you these words. Now remember, systolic or systole is contraction, and diastole means relaxation. Okay, so your blood pressure is taken every time you walk into a doctor's office or a urgent care or a hospital, because it is incredibly important to make sure that everyone maintains a healthy blood pressure. So remember, a healthy blood pressure is 120 over 80. And what we're actually measuring is that 120 is measuring systolic pressure. The 80 is measuring the diastolic pressure. So systolic pressure is the highest pressure as blood is ejected during ventricular systole. Now, as blood is ejected from the heart into your arteries, that's the highest pressure of the blood. Okay. Now, during ventricular diastole, we should have the lowest pressure, and we can actually, measure both with we can use a stethoscope and the little reader for the heart, or that now they use electrical ones. Normally, if we were in lab, we would actually be practicing this, but unfortunately, we are online completely. All right, now what we're showing here in this picture is an individual who indeed has high blood pressure, and this is very dangerous. Okay, having high blood pressure, what that does is it creates this force. It causes pressure against your arterial walls, which is bad. And this eventually causes strain on the heart. And basically, this could give someone a lot of problems. In fact, hypertension is high blood pressure, and it's called the silent killer. It's called the silent killer because it's completely silent, and the only way that we would ever know if you had hypertension is by taking your blood pressure, and that is why they do take your blood pressure every single time you walk through a doctor's office, to make sure that your heart and your cardiovascular system is okay, because you only have one heart. Okay, so let's talk about a couple of disorders aside from hypertension. Cardiovascular disorders are pretty interesting. They are also very scary, but they're important to understand. Okay, so angina. Angina is when your coronary artery is blocked. Now, here's the deal with the coronary artery. If you look at the heart, I'm going to zoom in on the heart here. Okay, let's look very, very, very close. Now, I mentioned that every single tissue and cell has to have a capillary or arterial network that delivers oxygenated blood to those cells and takes away deoxygenated blood from those cells. Okay, the heart is no different. The heart has these amazing, very sophisticated network of arteries and veins, and the main artery, one of the main arteries, is called the coronary artery, and it's right here on the outside, and it's pretty big, and it wraps around to the right and left side. And the coronary artery delivers oxygen and nutrients to the cells of the heart. Now, if something blocks the coronary artery, And this happens from high cholesterol. There's different reasons for the blockage. It really just depends on the individual. But see this blockage here? That means that these cells are not getting enough oxygen, and what can happen if there's disruption or blockage in the coronary artery, aside from you could basically have a heart attack, but the biggest issue, the scariest part is these tissues, the tissue of the heart could actually die due to a blockage, and it will not repair itself. That's one thing that is irreversible damage. Okay, so angina is not blockage. It's in fact when arteries are narrowed, the coronary arteries. Okay, full blockage. Now that's a different story. You block the coronary artery, you are going to have, or the system will have a full heart attack or a myocardial infarction. Okay, so angina is narrowing of the coronary artery. If there's blockage of the coronary artery, that's a myocardial infarction, aka a heart attack. Anything that is involved in the heart is incredibly delicate. Now, a couple more things. I already mentioned hypertension. Let's talk about an embolism. This is an embolism right here. Sometimes veins, arteries get these blockages in the vessels, which impair blood flow. That is an embolism, and they're dangerous depending on where they are, especially a pulmonary embolism that can actually, lead to death. Okay, a stroke. A stroke is when there is blockade of blood flow to the brain. So you have these two main arteries going towards from the heart up to the brain. Anything that blocks those two arteries can cause a stroke. And how detrimental the stroke is determined by how long the individual is how long oxygen is cut off to the brain. If it's nanoseconds, there's some damage, but not major damage. But if it's a long time, it just depends. Some people come out of a stroke and they are just completely, gone. They're a vegetable. Some people come out of a stroke because it was so minor and they recover and they can talk again and they're fine. It just depends. So these are a couple of the cardiovascular disorders. And that is the end of the cardiovascular system. Okay.
A single cardiac cycle is made up of the events associated with one heartbeat. Each cardiac cycle takes about 0.8 of 1 second. During each cardiac cycle, pressure changes occur within the chambers of the heart as they relax and contract. As the chambers relax, they fill with blood. This is called diastole. When the chambers contract, the blood is expelled. This is called systole. At the beginning of the cardiac cycle, the atrioventricular, or AV, valves open. This allows blood to begin to flow into ventricles from the atria. At the same time, the pulmonary and aortic valves are closed, preventing blood in the pulmonary trunk and aorta from entering the ventricles. Ventricular filling is completed by the contraction of the atria, or atrial systole. The contraction results from a series of events, beginning with the spread of action potentials from the sinoatrial, or SA node, across the walls of the atria. The spread of action potentials results in atrial depolarization, which is represented by the P wave on the electrocardiogram, or ECG. Atrial depolarization leads to contraction, or systole. Atrial systole is represented by the PQ segment on the ECG. Near the end of atrial systole, impulses from the SA node reach the AV node. Impulses spread from the AV node along the branches of the atrioventricular bundle to the Purkinje fibers in the walls of the ventricles. This results in depolarization of the ventricles, which is seen as the QRS complex on the ECG. The atria repolarize, the walls relax, and they remain in diastole for the rest of the cardiac cycle. Atrial repolarization is not seen on an ECG because it is masked by the QRS complex. In ventricular systole, or contraction, increased pressure in the ventricles forces the AV valves closed. The heart sound associated with closure of the AV valve is known as S1 and is described as lub. With continued contraction, ventricular pressures increase until they are higher than those in the pulmonary trunk, and aortic valves open and blood is ejected from the ventricles. Ventricular systole is represented by the ST segment on the ECG. In ventricular diastole, or relaxation, the ventricles repolarize. The T wave on the ECG represents this ventricular repolarization. Ventricular relaxation results in decreasing ventricular pressure. During ventricular diastole, blood in the pulmonary trunk and aorta flows back toward the semilunar valves, causing them to close. The heart sound associated with closure of the aortic and pulmonary valves is known as S2 and is described as dub. After the aortic and pulmonary valves close, pressure in the ventricles continues to decrease. When intraventricular pressure falls below the pressure in the atria, the AV valves open and the cardiac cycle begins again.